All right, lots of people complain about bags under their eyes even when they're not tired, but did you know that there are different kinds of bags and how you treat them can be very different too?
We met one woman whose bags got so bad it was actually affecting her ability to do her job. She found help at the Stanislaw Plastic Surgery Center in Avon, and that's where we went to learn more.
It was really a terrible time, I think, my family could certainly tell you about it because it became obsessive with me. For the first time in my life, I didn't like the way I looked, and it seemed to have come on overnight too, where one day I woke up and there were just lines here, and then suddenly I noticed some more puffiness, but not that different from just under-eye puffiness, only it was down here. And then one day I woke up and I just screamed when I looked in the mirror because it was all red. It was sort of like raccoon-like.
Ann Young was suffering from festoons, a kind of bag under the eye that looks like a drape and won't go away without treatment.
People noticed this. This was bad.
As a manager in the healthcare industry who has to do a lot of public speaking, Ann was worried about getting help fast. Dr. Paul Stanislaw knew right away what was wrong.
So a festoon essentially was not a bulge here, but this skin was sagging way down. Like you can almost still see that the skin down here is still a little bit thinner here. So it draped, the skin draped all the way down like this. And every time she'd close her eyes, the muscle underneath would tighten that skin up and pull it up and flatten it out. And when she relaxed, the festoons would form again. So it's really a combination of skin and the associated muscle underneath. And what we're just trying to do is trying to tighten that skin up.
Dr. Stanislaw says when you're reading about eye bags online, beware. Festoons are often grouped with Malar bags, when he says they're actually different problems with different treatments. He says Malar bags or mounds do not have wrinkles over them, but they do have a sharp crease like you see here. Online, Ann saw some doctors recommended surgery, though Dr. Stanislaw thinks that's a bad idea.
That procedure might look good right in the very beginning. However, a study showed that at 5 years, the 80% of the people that had that surgery, it changed the shape of their eyes.
So you're grateful then that you found that out?
Yes, I'm very appreciative. As I said, he was always very truthful with me. He said there's a lot of quick fixes you'll read about, but they're not what you want to do. So I was always very confident he would do the right thing.
Tell us about the treatment you did decide on.
So the first thing that we ended up doing was putting fillers into her cheeks because it had sort of the least downtime. We injected fillers to try to lift up the cheek and try to pull out all that extra very, very thin skin. So this is Restylane, actually Restylane Lift, which is the thicker version. The hyaluronic acids, the Restylanes, the Juvederms, all those products come in different thicknesses. They come in thin, medium, and thick. The thicker the product, the more it stays where you put it and the more it lifts.
Dr. Stanislaw uses a cannula instead of a standard needle to minimize bruising.
What I'm trying to do is I'm just trying to lay little strands of it and building it up into the right way.
And how long would the appointment be to do this?
Boy, it takes me about an hour usually.
But that's not bad, about an hour. And were you able to go about your business afterward?
Oh yes, definitely. As a matter of fact, the swelling often wouldn't come till a little later anyway, so I could definitely go about my day.
Along with fillers, Ann used Retin-A at home and other skin acids to smooth the surface of her skin. And Dr. Stanislaw also prescribed a medical-grade chemical peel. Ann had it done right here in the office, but because the peel goes deep, she would have some downtime with redness and peeling. But she says the results were so worth it.
Well, I feel so much better now. I mean, as you can see, most days I get up, minimal amount of makeup, I'm good to go.
Similar techniques are effective on other types of bags also. Do you notice a bulge and a deep crease more to the side of the face? Again, that's a Malar bag.
The best treatment here is for filler. I inject filler in there to lift up that crease and to blend it out like spackle.
You can see the fillers make a big difference in the before and after pictures. Whether the bags came on fast, like in Ann's case, or started to deepen over time, knowing how to diagnose which kind you have and how to treat them makes all the difference.
This is something different. This is why makeup artists can't help you. This is why people are wondering, gee, your bags are in a strange spot. It's because there's a reason for that, but that there's help. It can get better. Just need to go to the right person.
Remarkable.
Yeah, really a huge difference for her. And for more information or to book a consultation with Dr. Stanislaw, you can go to his webpage. It's stanislawmd.com.
All right, coming up tomorrow.